Good evening, doctor and my friend. My name is Sherlock. So what I gonna talk today is child development and counseling program. So what we gonna talk today, we have divided into 5 parts, which is introduction, vision and mission of this program, therapies, procedure, and lastly, ethical issues that we may face during the process. So, what is this program talking about? This program will focus on young children, teens, and adolescents with one or more mental illness. It also provides aids to young who experience trauma or experience a dysfunctional or stressful home event. By involving child counselor, they will offer an invaluable insight into your child's social and emotional development and mental health. They have the knowledge and expertise to recognize and diagnose a range of mental health conditions, adjustment issues, and psychological distress. It is important to understand that children are often suffering from mental health issues or psychological distress. They might choose not to share their concern with their parents. That doesn't happen because it doesn't mean that your child doesn't love their parent. It just occurs because they feel disappointing their parents. Next, vision and mission. The vision statement of this program is to provide aid to children in their development by involving child counselor. Children able to develop their abilities and become successful individual with a promising future. And about the mission statement, we believe that every children should be treasured and valuable. And by providing psychological service, children will able to empower and to perform and have the opportunity to participate the environment around them. Normally in the counseling section, we have 5 stages. First will be initial disclosure, second, in-depth exploration, third, commitment to action, fourth, counseling intervention, and then lastly will be evaluation, termination, or referral. So in the first stage will aims to have a relationship building. The counselor will trying to build a relationship and engaging client to explore the issue that direct affecting them. The first session was really crucial because the client was perceiving, they might think that the counselor, or is this counselor able to help me, or am I able to gain something from this counselor? And the second stage, in that exploration, the aim of this stage was to assess the problem, involve the collection and classification of information about the client's life situation and their reason for seeking counseling. And the third step, commitment to action, which aim to have goal setting. The counselor will set goals to proceed to the success of counseling, making a commitment to a set of conditions, to a course of action or an outcome. The fourth will be the counseling intervention. Basically, this step is deciding which therapy we gotta use and which therapy is suitable for the client to reach the goal. And lastly, evaluation, termination, or referral. After all this section, what we gotta do after all this section? Basically, we'll proceed to a successful termination or refer to others. It depends on the situation of the client. And this is the therapies that we gotta use in this program. First will be CBT, cognitive behavioral therapy. Second will be play therapy, as known as TPT. And lastly, dialectical behavior therapy, DBT. So what is CBT? CBT basically is a talk therapy that able to help people in all ages. How it help children? It help children to learn ways to manage their stress and also reduce their emotional sympathy for anxiety and depression. How it benefits the children? It help them to interpret their environment differently, or it might help them interpret their environment in a positive way. And second will be replace negative thought with positive one. And third will be improve communication with others, reduce their anxiety and phobia. Because sometimes children they might face adjustment problem when they are enrolling in the school. So it's easy for using CP2 to help them change their thoughts. Second will be the play therapy, known as PT. So counselors believe that by using the power of play, we are able to resolve children's psychological difficulty in a smoothly way. Normally, the counselor will put them into the playroom. The playroom basically is a special space for design for children. It contains, because we believe that the playroom will contain something to represent everything in the child's world. We will use a range of toys will allow a children to understand that a range of behavior are permitted in the playroom. It also supports the issue of aggression, regression, independence, and mastery that foster nurturing acceptance and contentment. So the benefit of using PT, which to allows the children to express them freely and it will be done in accordance with their pace. It also gain insight into their behavior and experience the national consequences of their action. And lastly, we will allow the children to save operant at reduced level of stress. So the last therapy what you are used in this program will be the dialectical behavior therapy. So behavior therapy which will use for the adolescent because past researcher has found that adolescents have included young with BPD, which is bipolar features. Other study also targeted young with various psychiatric disorder and problem behavior. Because adolescent now also can present with similar dysregulated emotion and problematic behavior, most and more importantly, they also present the emotional dysregulation, which is it is a really serious problem. And the benefit of using DBT, we will help people with difficult with emotional regulation or are exhibiting self-destruction behavior. If you are able to identify maladaptive emotional thoughts and action and significant correlation between problem behavior, and negative thinking with mouth. So lastly, we are able to improve their quality of life by guiding them. Basically, DBT is an improved version of CBT, but if your client is facing really serious problem like suicide identification, suicide thinking, we are using DBT for it. So last part is the ethical issue. So what kind of problem that we might face in the ethical issue, which is privacy, confidentiality, and privilege. So what is privacy? Privacy refers to the client's right to choose who has access to information about them. Legally, parents of minors typically make all privacy-related decisions from them, which include signing consent, release of information, and access to the medical and psychotherapy record. Second will be the confidentiality. So the counselor should not share any information without authorization to others. And the lastly will be the privilege. So the privilege which refer to the protection of private information. It was established by state and depends on the types of mental health. So some stated sometimes allow privilege to adolescents at the age of 16 for specific issue. The legal rights to privilege communication can only be waived by the client adult in the process of legal discovery. That's all from me. Thank you very much.